As the largest municipal hospital system in the United States, with a workforce of over 40,000 employees, New York City Health and Hospitals provides health services to 1.1 million patients on an annual basis for some of our most vulnerable populations, with over 415,000 of those being uninsured. In 2020, COVID-19 changed all of our lives. In March of 2020, New York City quickly became the epicenter of the COVID-19 pandemic. We had to act fast to continue providing critical services to our patients who were quickly filling up our hospitals and to our workforce who was stretching thin. We responded immediately by implementing the HR COVID-19 Response and Emergency Preparedness Initiative to combat the impact of COVID-19 crisis on our system. One of the first things we did was to identify those employees that could work remote. In addition, we implemented telecommuting policies, which was a first for New York City Health and Hospitals.
When I reflect on our response to the pandemic, what resonates with me are three key words: committed, essential, workforce. We always knew that our workforce was important. Our response to the pandemic naturally shifted our focus on the workforce that was essential to meet the needs of our patients. And by essential workforce, I mean everyone played a pivotal role. It was important that we showed support quickly. With the increase in patients being admitted and staff testing positive, we activated a continuous communication plan and strategy to support them. We enhanced staffing levels with supplemental staff in all categories, clinical and non-clinical. We brought in temporary staff, broad-banded roles, added volunteers, and had the participation of our military. We streamlined processes and looked at different ways to perform our jobs, whether it was implementing alternative work schedules, telecommuting, or enhancing our reliance on our computer systems. We tried everything to alleviate the strain on hospital staff. We centralized onboarding and implemented our disaster credentialing process.
Throughout the crisis, to ensure the health and safety of our staff, our office partnered with Human Resources to implement additional resources such as delivering weekly mental health webinars, providing on-site meal deliveries to frontline staff, free taxis, and free childcare services. We partner with them to create COVID-19 related policies for staff safety as well as online educational training.
We worked closely with HR to build the Test and Trace Core, hiring 1,300 staff in a 2-month period so the program could launch on schedule. This program has been critical to slowing the spread of COVID-19 by conducting testing and tracing throughout New York City. The Test and Trace Core has since become the largest and most successful testing and tracing operation in the country.
Our workforce remained and strengthened the words of committed, essential workforce. And for that, we are forever deeply grateful.